Good afternoon, everyone. Before I start, Tim left me standard speech, which I'm not going to do because it's not mine. Could I just have a show of hands for who here works for a CCG? Not that many. And who here works for a CSU, Commissioning Support Unit? And then what about suppliers? Okay. It just helps me. I wanted to make it a little bit interactive, and so I'll tailor the speech towards the audience. I'm going to talk a bit about a vision for a patient-centred NHS, and I want those of you in CCGs and CSUs to be having a think about how you are going to help to contribute to this agenda. So I've got a young assistant here with a microphone, and in the second half of the talk, rather than me just blah on, I want to hear from you about how you think you're going to help us to achieve the vision. So to start off with, the vision within it for NHS England, and I realise I'm competing with other talks here, is that everyone has greater control of their health and well-being. It's central to what NHS England is about. And in our business plan, one of the big important things is about making sure that patients have a positive experience of care. The way that Tim Kelsey has encapsulated that vision is through what we're calling transparency and participation. So transparency is about data. It's about using data, it's about freeing up data, it's about linking data. And if Tim were here today, he would be talking at length about all the work that we're doing to make data available to help make informed clinical decisions. The other part, though, is participation. And although part of that, a colleague of mine, Giles Wilmore, is leading on what we're calling patient voice, given that I've been asked to stand in, what I want to talk about today is the vision for technology. Harnessing the power of technology to unleash the power of people. How are we going to unleash the power of people in the NHS through the use of technology to improve transparency and participation? In December, we're currently working and consulting, and in December we're planning to publish a technology strategy for the NHS for the next 10 years. I just want to give you a little feel for some of the aspects of that today. So the first part of unleashing the power of people is about achieving customer service. If you like, it's finishing the job that the MP-FIT started, having a look at what should be done nationally, what needs to be done locally, and actually drawing a line under the past and some of the national top-down programmes. So today, this morning, I launched the new Nhs Ii Referral Service, which will replace Choose and Book. Thank you to all of you who came along to listen to that and who've been along to the stand today. We've started a consultation to listen to GPs, patients and providers about what they want in an e-referral service for the future. Within primary care, we're committed to allowing patients to have GP appointments, create GP appointments online, and we're in discussion with GPs about how we make that a reality. Repeat prescriptions online, access to patient records, and e-consultations in the form of Skype and other types of technology that actually make it easier for the patient to do business with the NHS. So that, for me, in the next 3 years, is a big priority for me. How do we actually make it easier to transact and interact from a patient perspective with the NHS? And as I said this morning, it needs to work for the clinicians as well. We can't make their life harder. We need to use technology to make a win-win for the clinicians and for the patients. The next big part of unleashing the power of people is around creating an integrated digital care record. Now this is a journey. My view is if we leave the NHS to create digital care records themselves, they'll probably do it in about 20 years. And I think that's too long. The vision is we're going to do it in 10 years. We're going to start the journey now, and primary care are among the best in the world at having digital record keeping. But safe digital record keeping is not the best in the world in secondary care. And so I need help from CCGs through their commissioning role to help make this a reality. You will have seen that we launched, the Secretary of State launched on 17th of May a £260 million technology fund, and on the 1st of July we will be going out with more detail about how to apply for that money and the rules and the expectations and support and guidance that will be available to secondary care trusts to help get off paper and start moving towards a digital reality. It's a bit like meaningful use in America. We're going to be using money and the incentives to get people moving on this journey. But it's also about accelerating those people that are already doing it to move to the next level. So in many places in England at the moment, we have fabulous examples of joined up digital care records between primary and secondary care. And so what the Technology Fund will also do is help to push those people across into social care and other wider care settings, okay? It's not just about bringing up the laggards to the level of where everybody else is. We want to keep pushing to try and achieve an overall integrated digital care record. NHS number as primary identifier will be in standard secondary care contracts from April 2014, and we're working with CCGs to make that a reality. We need to understand what your views are on that through the consultation, but it's a really big driver towards linked up data, that NHS number is embedded, as it is in primary care. So Professor Bruce Keogh will not mind me using the quote that he said to me, that integrated care, the only way we're going to achieve integrated care is if we've got integrated digital care records. We need to transfer patient information safely across care settings, and the way we do that is through digitisation. And then the other big part of the technology strategy, unleashing the power of people, is about putting patients in control so that they can manage their own care. Long-term conditions, telehealth, telecare, use of mobile devices, many of you are already doing this, are already out there. If we can get the underpinning technology right, if we can have the basics there, then it will not be difficult to then start pushing devices into the hands of patients so that they can look after their own conditions in conjunction with their GPs and their primary care providers. So that's the vision, the high-level vision. What I really want to do now is move on to the more interactive part of the talk, which is really to talk to CCGs and CSUs about what you can do to help make this a reality. So what we'd like in NHS England ideally is that across the agenda of transparency and participation, I'd like each CCG to choose one area or two areas that they're going to champion over the next 12 months, whether that be Nhs Ii referrals, integrated digital care record, access to records, GP appointment bookings. I need to know which of the areas you're going to champion and try to make a reality within your patch. Obviously, contracting for NHS number and safe digital record keeping from April 2014 is really, really important to us. But actually, as CCGs, you are ideally placed to create this technical revolution across your health economies. And that's why I need to really reach out to you on that. So my team are here today. So I'd like to introduce Andy Williams. Say hello. Okay. And I've got Mike Part. Where are you, Mike? There. And then is Trevor here? Trevor Wright? No. Well, I can't introduce to him because he's not here. So these two guys, I've got no aids because I didn't do a presentation. Andy.Williams at nhs.net and Mike.Part1 at nhs.net. If you're in a CCG and you want to get involved and take part and help make this a reality, write to one of them and we will be in touch. We've already got Islington CCG and Oldham CCG that we're talking to about some of this, but we need more. We can't do it to you, you need to want to do it, okay? So that's the start of a 10. The next thing I need to talk to you about is commissioning support units. Now, what I'd really, really want commissioning support units to do as part of this unleashing the power of people is to build skills and buy skills to help make this a reality. You understand NHS systems and processes. You understand the way this works, okay? But I want you to start supplementing the skills you've got by engaging the market. SMEs, large firms, people who understand how to implement technology, start to engage with them to build a broader skill base so that you can help CCGs and the wider NHS achieve this. I am extremely passionate about technology and informatics leadership, and I have felt that for the last 10 years, IT professionals, CIOs, IM&T directors, whatever you want to call them, have had quite a rough ride and not been felt that they're a central part of making this happen. The CCIOs that we've now got in place are an absolute linchpin for bridging the gap between the medical community and the IT community. But equally important are the IT directors, the system analysts, the project managers, the programmers who are actually going to make this a reality. And through a blend of NHS staff in commissioning support units and the market, we need you to help do this. So through my team and through the rest of the year, when we launch the technology strategy in December, we'll talk more about some of the support that we want to put in place to attract people to come and work in the NHS from the private sector. Get some apprenticeships, people out of university helping to make this a reality, because we're not going to be able to deliver this unless we have those skills. And the other point for CSUs is, I think that we need to invest in helping CSUs to have procurement and commercial skills. The G-Cloud frameworks and other procurement frameworks that are available to help buy goods and services, buy medical records, patient record systems are all there, but many colleagues in NHS don't really know how to access them, don't really know how to, it's onerous, it feels hard, it feels difficult from a procurement and commercial perspective. So that's what I want from CCGs and CSUs. I'm keen to know what you think you'll do, and also to begin a dialogue about how we can help you to do that together. So with that, I'd like to open the floor up to, let's start, anybody from CCG's got a view about how they can help unleash the power of people? I did give you a bit of notice.
Okay, let me come in as a start then, because I've got enough grey hairs to have been around for a long time and have been an enthusiast for technology. I think the difficulty a lot of CCGs are going to have is they've been let down too many times by the NHS, by the big ideas and the vision and the enthusiasm from the centre that has never delivered on the ground. And I think that's going to be a big hurdle to overcome this time. I've heard a lot of enthusiasm from you, a lot of vision. I'm still not convinced about the delivery. Can you help me?
Yeah, I can. In particular, what delivery of the whole thing, or
anything?
Well, to be honest, one of the first things I've tried to do is to set a realistic timescale for this, because obviously the press are here, and what they want to know is when are you going to get stuff delivered by when. And I do think that we need to put some realism on this. I'm much more interested in delivering technology that clinicians are going to use than buying stuff to meet a deadline that then sits on a shelf. We've got to get past that. We can't, technology is not the answer, it's the enabler. It's the system and process change. So the stuff that we deliver centrally, I'm on the hook to deliver. But there's so much more that you can all do out there that you're empowered to do as CCGs. And I want to strike that balance, Peter.
Good, thank you. Other questions? Come on. That's it, get your hands up and then we can ask some.
Thank you.
My question is around your idea of vision of a...
Hold the mic very close because it's very...
Your vision for an integrated digital care platform, how does that square with the empowered patient with long-term conditions and need for good information and knowledge?
Okay, so the integrated digital care record vision is about allowing a clinician or a patient, but certainly in the short term a clinician, to be able to have a look at all the history of what's happened to that patient, including their medicines, allergies, history. in an easy to absorb way that allows them that informs clinical decision making. So at the moment, all the primary care records are accessible electronically. But if you want to know about an episode when someone went into an A&E far away from their home, it's sitting in a filing cabinet on a treasury tagged bit of paper. And there's no way that that can get linked up. So before we can join everything up, it's got to be off paper and onto digital. Long-term conditions and decision support aids and giving people access to those kinds of materials is all doable now. Okay, so they're not necessarily linked, but what I need to do is paint a vision for how we're going to create for the whole thing. Just remind me again the question about the long-term conditions.
My question relates to the fact that you want patients with long-term conditions need access to their results, their clinical record, and they often have a patient-held record. So how are you going to deliver that in a technological way?
Well, by making the record full and meaningful for a start. So that part of the vision is to create access for patients to their own records.
Right. So patients will have access to the integrated care record.
That is the vision. But at the moment, if we give them access, it'll be half empty. So there's no point giving people access to something. Click a button, lovely front end, nothing there. So we need to do both.
Other questions?
This lady here.
Not so much a question, but the possibility that you can develop an app. There's a card going around at the moment, which I've only just found, shows how behind I am, called ICE or ICE, in case of emergency, which carries all the vital information about a patient, including their medication. Now, some people put it on their phone, but if you developed an app which everybody who had a mobile phone could put on their mobile phone, and the contents of that ICE profile is negotiated with their GP, that picks up your point about people with long-term conditions having access to a wider opportunity. I think the other thing is, it's a bit like care plans were some years ago, when the care plans were delivered to the patient, and then there was a shift to negotiation with the patient. I think at the moment, records are given to the patients, or not, as the case may be. Maybe there is an opportunity here to create the digital record by negotiation between the patient and the GP. What do you want in your records?
Well, that's exactly right. And we need GPs to own this. CCGs and GPs need to feel comfortable with this. I can't do this from the centre, and I don't want to do it. It won't be owned, and each CCG needs to decide where it is in its own level of digital maturity to make this happen. But all of the above. Thank you. Have we got the mic?
I can speak very loudly. Just to continue that theme, how are patients influencing your work, your team's work? Where are the patients in this process that you're designing? I mean, do you have a patient liaison? Do you have a patient representative?
So within Patients Information, Giles Wilmore and Olivia Butterworth have created a forum to allow us to road test some of our ideas with patients. So I've got patients on all our programme boards, etc. And very much with e-referrals, which is the first thing we're launching today, that the user journeys and the patient journeys have to be tested with patients. And that means patients from all kinds of demographics and scenarios to just test that we're building something that they feel will be usable. So involving patients needs to be central to absolutely everything we do. Having said that, I really do need to bring clinicians with me. So over the next few years, if we can get the clinical community to embrace technology and we create a tipping point, then I'm really quite happy to campaign with patients and patient groups so that they can say to their GPs, my friend gets this, can make appointments online and order repeat prescriptions, why can't I? But I don't want to do that now because I want clinicians and CCGs to buy into this first and I don't want to pitch them against each other.
Could I ask a supplementary question about that? Many clinicians, mostly obviously in secondary care, can't access many of these technologies because of their trust firewalls. I mean, they're not able, I know many clinicians can't use Skype from their trust, so have you got any vision for?
We do.
Okay.
So we need to create the rules, the standards, architecturally, security, so that we free up you to all do this, okay? Now at the moment, NHS Code of Connection, NHS Net, NHS Mail, very good secure ways of working. We're going to make sure that any Skype follows similar standards. It's very, very difficult at the moment for the supplier community, I'm being told, to get these kind of connections. It's a long time, there's a bureaucracy, that needs to be fixed. We need to be more nimble in the centre. We're not going to dilute on safety, on security, but we do need to be more reactive and responsive to CSUs and CCGs and the supply community to do that. So those are the kind of things that I think that we should be doing in the centre, but actually saying whether or not it needs to be the ISON art or whatever, that's not for us to say. It's about creating the right environment. And I can feel the cynicism. NP Fit, they're all in the PAC now. They're standing there getting grilled at the Public Accounts Committee. And so I'm not starting from a 0 position, I'm starting from a -20 position. But we can't go back to paper. It just feels wrong to me to say, let's stop doing it. In this day and age, moving towards a technological future, we've got to stand up to scrutiny on delivery, and we will. But today's about a call to arms and a vision. That's the vision bit. Okay.
Other questions across the side?
My question really is to say that I know you're great, get all these 100 flowers to bloom in all these different ways, but I have a vision for an NHS which has standards so that when I move from one area to another, or different members of my family will have the same offer. So I would like to see more standardisation of that kind of offer and those apps that you're talking about.
That's not unreasonable. And what we want from standardisation is standard data, NHS number, consistently. We need to be able to deliver the same kinds of functionality, but how we deliver that? In a private sector world, in retail, in our buying, we don't expect to only go and buy all our food from Tesco. We want to have choice to buy from different places. So it's about a balance between standardisation. We tried standardisation and it hasn't worked. So what I want to do is not throw the baby out with the bathwater. There's some good stuff that we delivered in the last 10 years. We're going to harness that, keep that, work on it, improve it, like Choose and Book, Nhs Ii Referrals. But actually, where the NHS is best placed to do it for themselves, let's let the NHS do it for themselves. So, but it's a good point. So, with 5 minutes to go, CSUs, Commissioning Support Units, what do you think about skills, technology leadership? What can you do to help make this a reality? There were a few here.
I'm a locum doctor. So do you think how much workload will be added to the work of the doctors will deliver all these reports and then to scan it? Because now we are facing a huge workload with all these documentation. I'll speak about the mental health care we deliver. We used to write on piece of paper, but now we need to write everything just to make it uploaded. And this takes a lot of our time. And if you think with the cut in the numbers of the doctor employed, and who will do all this work?
Yeah. So obviously the system benefits of joined up data for 2 commissioners is all very laudable, but the clinician with the patient in front of them doesn't see the benefit of that. They just want to know how it's going to make their life harder, etc., etc. And so we've been looking across the NHS at examples where it's actually made the clinician's life easier by using technology. Now, sometimes that might mean passing control back to the patient to manage their own long-term condition, which means they don't need to always be coming in to see the GP or going to A&E or using the service. There is an element of that. And I realise that we have to do a deal with clinicians around how their lives are going to be made easier. But we think we can do it. It's been done in many places. There is nowhere in the NHS today where I can't find someone who said, I didn't want to do this. I thought it was going to be hard, and it's better, and my life's now better. And we're going to be putting case studies out and matching everybody up to those people. But the fact is, it won't be easy. You'll have to change. This is a change programme.
Can I ask what the principles are behind your vision?
Well, the main principle comes down to improving the lot for the patient. If patients' outcomes are improved, if patients' experiences are improved, if we can draw a straight line between a pound spent on technology, it's got to be able to be direct to a patient outcome, a clinical outcome, an experience outcome. We've got to answer that. That's the test. That's the case for change. So we're listening to what people have said is working already, and we're looking at what we've done so far, and we're testing it against those levers. Tim's actually got 6 elements, case for change, economic growth. I can get them out. I'll get them all. But that's been the first piece of work to do. So these 6 tests. These are the 6 tests and principles against which everything we do needs to be tested.
Another question back there. I think we make this the last question, and then we'll wrap up the session.
Yeah. Beverly, as a clinician, can I ask how receptive you are to allowing technology to match new ways of working? So if you're disruptive in the way in which we do things at the moment, will you support that type of thinking, or at least consider it?
If it answers the tests,
yep,
and it improves patient safety, we can explain how it's making lives better for clinicians and for patients, etc., then absolutely.
Great, thank you.
Okay, thank you. Sorry I didn't have more slides. Really, really good to talk to you all.
Okay, thank you very much, Beverly, for standing.